as humans, we want to overcomplicate things, right? We want to know, you know, some crazy lifting technique that's going to allow me to achieve a new lifting PR. When in fact, the answer might lie in your breathing.
Hmm. Hmm.
But I want everyone to go back, hit rewind, hit pause right now on your listening device and go back about 8 minutes ago and listen to what Uchi had to say about breathing and breathing through your nose. But it's quite amazing how powerful breathing and a breathing practice can be as part of your fitness. Would you agree?
Yeah, fitness. There's talk about there's some amazing things to do. I know people actually that train only breathing in through their nose. It's hard to set up. You wouldn't want to run a mile breathing in through your nose. But there's people that said you can actually increase your max VO2 simply by having your mouth closed and breathing. You're usually not going to have the same amount of intensity because basically when you do a 100-yard dash, you're breathing in through your mouth and nose. But there's many different ways to do it. I think most dentists, we have intellectual disease. We make it complicated. But just inhaling more through your nose slows down aging, gets you out of sympathetic dominance, increases healing, improves hormone balance, and increases the strength of the immune system. So if I'm sitting there, if I'm not in a good place, without even taking action on anything that I need to take action on my to-do list, I can actually put my body in a better physiological place simply by breathing into my nose. And dental say, Ooch, how long for? In through my nose, out through my mouth. We make it complicated. I just said in through your nose. Out through your mouth is easier because there's less resistance, but you can go in and out through your nose. But again, people with sinus problems, massive. People eating a lot of, they're gluten intolerant or they have celiac or unresolved celiac. People with nasal defects can't breathe
Mm-hmm.
in through the nose on a regular basis. Or people have a narrow mid face. What happens is they do all the breathing in through their mouth. Anyone who's a chronic mouth breather always looks older, will always have more challenges with energy, mental clarity, always have challenges with the immune system, facial deformation, elevated inflammation. So you look at all the myofunctional hygienists out there, people do myofunctional therapy. They talk about taping your mouth closed. Again, this is more than what we talk about enough, but there's many, all I want to just, all I'm trying to do is just light the flame. I'm not gonna fan your flame, I'm just lighting
Right.
the flame, get people thinking there's another way to live life other than sympathetic dominance.